Most surgery in the neck is aimed at decompressing nerves, and surgery can be performed either through the front of the neck or through the back of the neck. Posterior cervical surgery, usually called a posterior cervical foraminotomy, is aimed at decompressing the nerve to alleviate nerve pain. That's pain usually running down the arm. In patients who have painful disc problems, they tend to get chronic neck pain and pain down the arm. And in these cases, the disc is removed. The traditional operation is to take the disc out from the front of the neck through a small incision at the side here and place a fusion device. This is called an anterior cervical discectomy fusion. The disadvantage of the fusion is it restricts range of movement of the neck and potentially causes problems at other levels. Performing a disc replacement is taking out the disc through the front of the neck, and instead of placing a rigid fusion device, we place a device that can move, i.e. a disc replacement, which is mobile. This potentially alleviates or reduces the incidence of adjacent segment degeneration in the neck and maintains normal range of motion. Patients who are appropriate to have cervical disc replacements are patients who have neck pain that arises from the disc. This usually means chronic neck pain that's quite severe. The pain can also travel down the arm because of irritation to the nerve. Patients are usually under 40 years old. As patients age, the discs become more collapsed, and some patients have discs that are too degenerate to place a disc. So in general, younger patients are suitable candidates for disc replacement. That's not always the case. I have placed artificial disc replacements in patients who are up to 50 and even 55 years old. Patients who are eligible for cervical disc replacement generally have pain that's been present for a long time. Most episodes of neck pain are due to disc herniations which settle within 6 to 12 weeks. These patients don't need surgery. For patients who have more chronic pain, i.e. lasting 6 to 12 months or even longer, occurs because the disc itself becomes degenerate and painful, and these are the candidates for disc replacement surgery. Performing surgery to place an artificial disc is performed through the front of the neck, through a small incision around 2 centimetres in length. We place the incision through a skin crease, so there's minimal scarring, and in most patients the scar is invisible after 3 to 4 months. The vessels and the trachea and the esophagus are moved gently out of the way to achieve access to the front of the spine. The disc is then removed back to the front of the spinal column. The artificial disc is then placed gently in place so it sits neatly in between the bones. The surgery takes on average around 2 hours. Most patients can go home the day after surgery. Some patients even go home on the day of surgery. Usually the recovery is very rapid. Patients are able to return to their normal activities within 2 weeks of surgery. Recovering from cervical disc surgery tends to be very rapid because the wound itself doesn't cause significant pain. Most of the structures of the front portion of the neck move out of the way very easily and move back into place. Most patients will feel a little bit uncomfortable with swallowing for a few days because of movement of the trachea and the esophagus, but there is very little mechanical pain from the surgery. Hence, patients are able to return to their normal activities and exercise program very quickly, normally within 4 to 6 weeks. Most patients who have disc replacement surgery are able to return to their normal activities, their normal exercise program, and are free of pain. In general, the cervical disc replacement technology has now been available for around 15 years, and our long-term patients do extremely well and return to normal activities. If you have chronic neck pain and you consider that cervical disc replacement surgery may be an option for you, you'll need to have an MRI scan performed and a bone scan to make sure the pain's not arising from the facet joints or other areas of the spine. If you wish to proceed with this, please contact my office on the address details available on this website.